So my name is Vilhelmiina Huuskonen and I'm a specialist in veterinary anesthesia. In veterinary anesthesia, our main thing is to keep the animals safe and stable and pain-free during surgery and complicated medical procedures. Most people think that anesthesia is just putting the animals to sleep and just giving them a bit of drugs and then waking them up. But anesthesia is much more than that. As an anesthetist, when we anesthetize an animal, we are taking control of their brain function, of their breathing, of their circulation. So we are really controlling their whole physiology during anesthesia. And then after the procedure is done, then we safely guide them back to awakeness. Residency is the main specialization period, and in veterinary anesthesia it's usually either 3 to 4 years. So during a residency, it's really full-time clinical work that you do under supervision. You're working under the supervision of a recognized specialist. You manage really wide range of clinical cases. They can be very, very complicated, and from routine procedures to complicated ones, and usually the level of challenge increases as you advance in your residency. And at the same time, while working full-time, you're expected to study, so you need to learn physiology, pharmacology, even the physics behind anesthetic machines and monitoring equipment. And you have to do research, and you have to publish your findings. You also have to teach both veterinary students and junior colleagues and interns. So it's really full hands-on period. And yeah, it's really a combination of hands-on work, academic work and research. And then after the residency is over, you're still not a specialist. So you can't call yourself a specialist before you have passed very challenging specialization exams, which are organized by the European College of Veterinary Anaesthesia and Analgesia. And these exams, they are quite similar to specialist exams in human medicine, and they test your clinical reasoning and the depth of your knowledge. So only after passing the board exams, only then you can call yourself a European specialist in veterinary anesthesia. I would say that a European specialist in veterinary anesthesia is very similar to a human consultant level doctor. Becoming a specialist requires well over a decade of very dedicated training in this one area. Being an anesthesia specialist, I'm a specialist of anesthesia as a discipline. I'm not specialized in any specific species. So my specialty is the discipline of anesthesia of all species, essentially. So my job is to keep the animal, whatever animal it is, to stable and safe and pain-free while a medical or surgical procedure is performed. Nowadays, the modern veterinary anesthesia can do really, really advanced things. It didn't used to be so. It wasn't possible before anesthesia was invented. Before anesthesia was invented, surgery was really limited, and the speed was the most important attribute of a good surgeon. Surgeons and medics can completely focus on the procedure. They can focus on safely performing the procedure, and they can focus on precision because they know that we are taking care of the animal and they don't need to distract themselves during the surgery, for example. So we can control the animal's consciousness. We can control the animal's pain, we can prevent it from moving while the surgeon or the medic does their advanced thing. Essentially, before we anesthetize a patient, we have to do a thorough assessment. So that means that we do a physical exam of the patient, try to find any underlying problems like a heart disease or respiratory disease or anything that could affect the anesthesia. We review all test results or diagnostic findings, if there are any, and we try to rule out liver disease and kidney disease or neurological disease and so on. And we also, when we come up with our anesthetic plan, we consider factors like the animal's temperament, the animal's age, any special anatomical issues that they might have, for example, respiratory issues due to very narrow airways, anything, history of vomiting or anything that could make the management of the patient's physiology or breathing more challenging. It's really important to remember that we tailor the protocol to the individual patient undergoing that particular procedure, and two anesthesias are never the same, even if they're undergoing the same procedure. Once we have assessed the patient, we tailor the anesthetic protocol to that individual patient undergoing that particular procedure. And I think the most important part of the anesthetic protocol is consider the anticipated problems or potential complications that could arise during the management. It's really important to be prepared, and I think that's one of the most important attributes of a good anesthetist, because if we are prepared, then we prepared for the complications, then we are prepared to recognize them earlier, and we have all the necessary drugs and equipment to intervene and treat the complication if it arises. In very sick patients, that could be critical for saving the patient's life. So preparation is the key. Then when we choose the anesthetic drugs, we try to choose drugs that would either prevent or at least minimize the anticipated complications. When choosing the drugs, we take into account all the findings of our initial assessment and the diagnostic procedures. For example, as a part of the anesthetic plan, we consider how we would manage the patient's airway, how we would support his circulation and blood pressure, how we will monitor the patient so that we will be able to recognize complications as early as possible. And then when the animal is anesthetized, we monitor all the parameters very closely at all times. We monitor the depth of anesthesia, we monitor their breathing, oxygenation, their ventilation, their heart rate, heart rhythm, blood pressure, and they again intervene if anything changes. After the procedure, we manage the patient's recovery and we ensure that it's pain-free. And they're both really important phases or considerations, as important as the anesthetic itself. And in fact, in veterinary patients, recovery carries the highest risk. The UCD Veterinary Hospital is a referral level specialist hospital. And that means that we are mainly involved in really complex and high-risk cases. We could have dogs that have a brain tumor, or cats that have a heart disease, or vice versa, or a horse that is coming for emergency colic surgery, or we could have a goat with a fracture, or any trauma patient coming for emergency procedure. And I'm also involved with quite technically challenging procedures. For example, we might anesthetize an animal for MRI or thoracic surgery. We have anesthetized animals for major lung or blood vessel surgery, during which it's really important to be able to manage the patient's breathing and blood pressure. We might anesthetize the patient with brain surgery or spinal surgery. And we do ourselves procedures like arterial catheterization, so putting a catheter into an artery to measure direct blood pressure and take blood gases for very specific assessment of the patient's respiratory status. We also perform ultrasound-guided local nerve blocks for pain relief. In addition to very sick patients and very complicated procedures, we are also involved in anesthesia of large animals and even zoo animals. It's really important to understand that when we move into very large species or very unusual species, the risks of anesthesia become bigger. So the bigger the patient, the more challenging the anesthesia, or the more unusual patient, the higher the risk. So for example, birds or reptiles, they have very different respiratory physiology than mammals. Or if we think of species like giraffes or hippos or rhinos, they are extremely challenging to anesthetize because of their sheer size. Of course, some of the animals that we anesthetize, whether horses or cattle or zoo animals, they can be very dangerous, further adds to the challenge. I'm also involved in pain management of all patients. I think that's a really important part of anesthesia. And we do that by using a combination of drugs and combination of techniques. The main thing is to ensure that the patient is not only unconscious during the anesthesia, but it doesn't feel any pain. It's essentially, even if the animal is unconscious, they can still feel nociception. That can develop into pain as soon as they gain consciousness. If that nociception during their unconsciousness is not properly managed, then managing pain afterwards can become really challenging. Essentially, a veterinary anesthetist and myself, I'm involved with mostly with cases that are higher risk or procedures that are more challenging and more complex, and situations where the margin for error is much smaller. Well, firstly, anesthesia is not risk-free, especially in animals. Animals, first of all, they can't tell us how they feel, and often when we see them, they are already quite unwell. So I think the role of a specialist is to recognize potential risks and to recognize them early and intervene as early as possible. Specialist is trained to recognize the risk and reduce it as much as possible. Secondly, the specialty of veterinary anesthesia is about managing complexity. Many, if not most, of our patients, they don't fit into a standard protocol. They might have multiple problems, or the procedure itself might be very complicated. In those situations, the whole anesthetic plan and the decisions, they must be tailored, and we must be able to adjust them in real time. Thirdly, there's animal welfare. Pain management, like I already said, is a major part of what we do. Poorly controlled pain doesn't only cause suffering, but it also slows the recovery, and it can lead to further complications. If your anesthesia and pain management is good, it improves both animal welfare and the outcome of the surgery. Really want to highlight it that even though animals are unconscious during anesthesia, controlling pain is still essential. If pain is not well managed during the procedure, it can then become much harder to treat afterwards, and it can lead to prolonged recovery or chronic pain. Fourth, veterinary anesthesia specialists support the whole wider team. Surgeons can perform much more advanced surgery, and medics can do much more advanced medical procedures, and they can fully focus on the surgery and on the procedure when they know that there's an anesthetist who is fully dedicated on both the pain management and support of the patient's physiology. Finally, the fifth is that specialists bring evidence-based approach to veterinary anesthesia. So we are trained to evaluate and conduct new research and refine protocols, and in general improve the standards of care. And we do that not just within our hospital, but also beyond. I would say that overall, specialist anesthesia improves patient safety, supports better outcomes, and allows veterinary medicine to do things that wouldn't otherwise be possible without anesthesia.